Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you for the opportunity given to me. Allow me to introduce myself. My name is Mutia Ismail. I will present my article with the title Description of Gastritis Characteristics at the Batalaiworu Health Center, Regency, Sulawesi Province, Indonesia of the year 2021. Faculty of Public Health, University of Halu, Oleo, Southeast Sulawesi Province, Indonesia, 2021. Introduction. Gastritis is occurs to many Indonesians from teenagers to the elder. Gastritis is an inflammation of the lining of the stomach, which is quite common and can have different causes. Many factors cause in the stomach to become an inflamed statement. First of all, it could be due to non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, naproxen, which are used in different treatment to soothe curtain ailment, i.e. rheumatoid arthritis. Secondly, inflammation can be due to abrasive compounds or alcohol acid attached, or an unbalanced diet in which the stomach is damaged by its own stomach acid. Signs and symptoms of gastritis depend on how long the problem has been present. If it occurs suddenly, it is called acute gastritis. In the acute stage, superficial gastric inflammation causes nausea and classic pain or discomfort in the upper abdomen. If it develops gradually, it is called chronic gastritis, and the symptoms may vary from acute with dull pain in the upper abdomen and a feeling of fullness and loss of appetite after several bites of food. However, in some cases, people with chronic gastritis may not feel these symptoms. Methodology. Primary data were collected using a discrete approach from the World Health Organization, WHO, step for surveillance of standard non-communicable disease survey methods. Data were collected from the General of Health Center Bataliwaru. Primary data collection is done by recording and copying the record document. The data used in this study are cases data of gastritis sufferers in the working area of the Batalaiworu Health Center, include Batalaiworu Sub-District from 2018 to 2020. The result of the study are present on image from as follow. Result of the study, number one, eating habit. Table number one, based on the table show that diet is a determinant of clinical gastritis pattern in the working area of the Batalaiworu Health Center, Regency. Number two, smoking habit. Table number two, based on the table, smoking is not a determinant of clinical gastritis and gastritis patterns in the working area of the Batalaiworu Health Center, Regency. Number three, coffee consumption. Table number three, based on the table and graph above. It can be seen that coffee consumption is not a determinant of clinical gastritis in gastritis patterns in the working area of the Batalaiworu Health Center, Regency. Number four, stress. Table number four, based on the table show that diet is a determinant of clinical gastritis in gastritis patterns in the working area of the Batalaiworu Health Center, Regency. Number five, OIEN is consumption or anti-inflammatory non-steroid medicine. Table number 5, based on the table and graph above, this show that coffee consumption is not a determinant of clinical gastritis in gastritis patients in the working area of the Batalaiworu Health Center Muna Regency. Conclusion, according to the result analysis in the study, it can be concluded that there is a relationship between the type of food or diet, stress, and consumption of certain drugs with gastritis cases in the working area of the Batalaiworu Health Center, Muna Regency in the year 2021, while the frequency of eating coffee consumption and habit smoking does not have a significant relationship with the incidence of gastritis in the working area of the Batalaiworu Health Center, Muna Regency. That's the result of my presentation, and thank you very much.